It's very bad. I feel a pain up to now because we lost boku people. We lost boku people.
In mama we been they take care of her, in back and die. Now then all 6 people then now then die.
We inside the family now we 12 and then 6 die so. And I mean only one brother we don't live. We don't live right now. Na Kenema.
This sick here we not be noting that Ebola really.
By then when the mommy get this Ebola, now the mommy get for die. And I be member of 4 mosques. Now all been praying at the same mosque.
It became body pain warm. Where the pikin lay in 8 per me die in 1 minute they meet me. I no go left sit down there, una all can die behind me back. Now I call now for the ambulance.
Yeah, I've been afraid with the people, the first people that they go, they not be they come.
When the Ebola attacked me, I not be the fear, I not be know whether if I didn't at the wall again.
This thing is real.
One of the things that we have learned is that you cannot deal with this with just one organization.
And so as NGOs, we felt like we needed to come together and to coordinate our roles to support the government and to support the people of Sierra Leone to stop the chain of transmission and to continue to protect the healthcare system.
The strength of the ERC was that it was harnessing the best of what all the organizations could offer.
We have a partnership. If we don't stay for the bad, you cannot expect the people to trust you to stay for the good.
We lost so many of our staff, health staff there. In 2 weeks, 46 people died from the village, Yaragrima. Team from Kenema came to take the patient. Our colleagues who were infected, who went to Kenema, they could not survive. We knew it was going to be a big outbreak. And this is the way actually Ebola came.
In early June, we had the first case confirmed in Kenema. What made the case different than any other Ebola outbreak the world has ever seen is that in Kenema, it was in an urban context.
You are having health workers who are very energetic to work. They are no more. Most of them lost their lives. You have others who get infected. They survive, but they lost their family members. Every day we are counting our days. When am I going to die?
And the health workers, we are blamed for the spread of the Ebola. People were now afraid to come to the hospital. Health workers were afraid to go to work. Healthcare workers are the most important assets in healthcare delivery. If there are no healthcare workers and people are sick, who is going to treat them? They have to be protected. If they are protected, they are not going to infect themselves. They are not going to spread the infection to patients, which can spread out to the communities. We needed to do a training to inform these people on what to do.
They now know how best they can screen people to know who is in a probable case, who is suspected case. Then they will know how best to treat, who is you are supposed to call for ambulance and the like. So they felt more confidence now in working.
A PHU is basically a peripheral healthcare unit receiving cases from the community around it, and it's the primary entry point for patients to the healthcare system. There was no screening system at that time, and there was no hand washing facilities for the patients. There was no system of waste management, so it wasn't at any point safe for the patient attending and for the healthcare workers.
The training was so organized by the ERC organizations together with the Ministry of Health and Sanitation. At master training, which is national level, our own role was to make sure we cascade. We send this training back at district level.
The exact same training, the exact same messaging, the exact same protocols were implemented in over 1,000 PHUs.
Now we have equipment like PPE, which were not there at that time, so they have been taken to the PHU level, where there is a triage system, where there are already trained cleaners and healthcare workers to be able to pick Ebola cases before they even gain access to the PHU. And at the same time, in the PHUs, we have a lot of knowledge because people have been trained more than once about IPC, and they know how to handle conditions better, which has translated into great confidence among the healthcare workers in rendering their services.
So because of the work that we had done at the primary healthcare facilities, the same group came together and tried to envision a program to support the district hospitals.
But our biggest fear was the city, where people live in one place, move to another, nobody knows about them, there's a lot of new people coming. This is going to be explosive and exponential, and that's exactly what happened. Connaught is the referral hospital of the country. One of the biggest concerns that we had is we cannot be without the referral hospital open. It's not only Ebola, it's like how many people have died of other things that are not Ebola because of being in a time of Ebola.
From the Ministry of Health at the national level, there was a real recognition there needed to be an IPC unit. There needed to be designated IPC staff within all hospitals.
The Ministry of Health and Sanitation appointed IPC nurses in each facility to work as a focal person and take the lead in IPC in the hospital. So nurses who have experience in IPC support the focal person and also build capacity.
It is very important that us as partners, us as IPC mentors work together with the focal persons for the ministry. So they were very receptive to my coming in, receptive to what we had to bring, the IPC policies and implementation that we had to put up. They were so cooperative and worked very well with us. IPC is a most important and integral part of our healthcare. All the healthcare workers need to be trained and get some understanding on IPC in order to protect themselves, as well as know how to protect their patients so that they're able to carry out their duties, they're able to give care in a safe way that will protect both them and the community as a whole. As partners, we need to work together with the ministry so that we are able to implement IPC and it becomes a permanent thing. It's not just something that is going to happen and ends, but make it something more permanent, something that is for the future.
Proper wash infrastructure is very important where we are dealing with Ebola virus. Ebola is a contact disease, and one key important aspect in the Ebola fight was about accessing water.
The team is actually trying to get more water to supply to the various wards and all stations so that the IPC will function well and be sustainable.
When the healthcare workers saw water for the first time, one thing they told us, this is success already.
In the early days of the response, ERC primarily worked in the national scale up of infection prevention and control and screening for all suspected Ebola patients in primary healthcare facilities. The other was to support surveillance.
When we came in, everywhere is Ebola, and the only remedy at that moment is surveillance, because we need to get the cases out of the community to know where that case is coming from. Communities are very paramount in the fight. Bringing the community people on board is like getting rid of all cases at community level.
So the consortium also said, okay, now that cases are going down or have gone down, can we come in with another surveillance method wherein it will be now a community-led? We also engage majority of our community health workers.
Training the community to maintain the referral network from the community to the PHU, from the PHU to the CMOC in Kenema town.
We were also asked in October last year to take on safe and dignified burials in the western area. It was very difficult for people to go from a very elaborate ceremony to going through this process of their loved one being put into a body bag. But over time we've tried to make it, to put as much dignity into the process as possible. There's a lot of trepidation about getting involved in this scope of work in terms of risk levels, but we felt that it was important in terms of the transmission chain at that stage.
Such remarkable hard work of thousands and thousands of people working together. And the commitment of the staff and the dedication was humbling.
We felt that we are of help. We felt that our presence here was really needed.
Any other outbreak that will find its way to Sierra Leone, it might not be of equal magnitude as Ebola because people are more prepared.
We are proud of the work of the government of Sierra Leone, Ministry of Health and Sanitation, because of the coordination of all these key players in the fight.
We feel proud of our work because we are really, fighting to relieve our country and our people.
King's Health Partners is a part of the ERC.
Kia is a member of the ERC.
ION is part of the ERC.
Wellbody is part of ERC.
Solidarity is part of ERC.
Oxfam is part of ERC.
Moda is a part of the ERC.
Médicos del Mundo is part of the ERC.
Save the Children is part of the ERC.
Goal is a part of the ERC.
Concern Worldwide is part of the ERC.
ABC Development is part of ERC.
EOP is a part of the ERC.
ACF is part of the ERC.
The IRC is a member of the Ebola Response Consortium.